We find it very hard that our employers and other healthcare facilities are not prepared to handle the crises. We need the proper equipment, the proper protection, the training, and the proper amount of staff to safely take care of our patients.
That's the head of the largest registered nurses union with a very scary warning. And I'm going to quote now from a piece in the Washington Post that further explains the situation. The growing coronavirus outbreak in the U.S. is revealing serious gaps in the health system's ability to respond to a major epidemic, forcing hospitals and doctors to improvise emergency plans daily, even as they remain uncertain how bad the crisis will get. Peace goes on to provide examples from around the country. Doctors in a Rhode Island hospital were testing people in the parking lot so the patients wouldn't enter the emergency room. Officials in Washington state, they're buying a motel to house and isolate patients. In rural parts of Texas, absolutely no test kits, so people have to travel for several hours just to get tested, and the list goes on and on. I want to bring in our next guest, Dr. Robert Lahita. He is a professor of medicine at Rutgers, New Jersey Medical School. He's also chairman of the Department of the Medicine at St. Joseph's Healthcare System. Doctor, thank you for the time. I appreciate it.
Thank you.
I just saw the governor of New Jersey speaking, and there was a sense from Governor Murphy that he's preparing for this to go from bad to worse. Obviously, the situation in New Jersey not as pronounced as New York yet, but within the medical community, I have to assume there's an assumption it's when, not if, the numbers explode.
I agree with you. It's certainly true that the numbers of patients will likely to increase. And we're gearing up for all of that. It's very important that we consider all of our options and consider this like a mass casualty event. In mass casualty events in emergency medicine, we relax some of our rules and we handle everybody in the appropriate manner by bringing in extra help and extra staff and considering how many beds we will need in the intensive care unit, how many respiratory machines, et cetera.
Doctor, one of the things I've learned from some of the other hospitals is one of, if not the most important message they're trying to get across to people, and they've set up hotlines for the rest, is for the vast majority of the people, don't come to our ER. There are better places for you because ICUs already are at max capacity in some places. They cannot handle the influx here, certainly to the emergency room where somebody can infect other people. They're trying to direct them to the proper places, but they're also trying to tell the people, just because you got, let's say, the sniffles or something else, the hospital is not the first place of recourse in every case. How important is it so you can manage the intake until you can manage the intake to try and keep certain populations from overwhelming your system?
Yeah, so we get calls. I get calls in my own practice every day from patients who have the sniffles, who have a sore throat, and that also pertains to children, although I'm not a pediatrician. So a mother will call me and say, my child has a sore throat, should I bring him in? And my advice, number one, is if the sore throat is profound and it prevents the child from swallowing, they should see their own private physician, their primary care physician, or go to an urgent center. If the patient or the child or the adult is not having a fever, is not having aches or joint pains or nausea and vomiting, they should not come to the emergency room. Because what happens when they come to the emergency room? They're quarantined, they're placed in a specific area. They wait for 6 hours until the nurse or the doctor can get there to test them. And this results in them possibly getting infections from other people, or in fact, giving infections to other patients. So we would advise, if they are not terribly ill, to stay home or go to their private doctor's office. And the private doctor is going to call them and ask, have you a fever? Are you feeling like you're having difficulty breathing? That's the major point. If you're having difficulty breathing, then dial 911, and then you go to the emergency room and we evaluate you. We evaluate you as a possible respiratory failure, and that's a whole different ballgame. Now, there are many causes of fever, muscle aches, and breathing problems. Among them, it can be the plain old influenza or other kinds of infections. So you have to be very careful and be very discerning. And so we don't want to cause a panic by having people come to the emergency room and get infections, or in the terrible case of them having coronavirus, giving it to somebody else or giving it to a lot of people in the waiting room.
Doctor, I have not talked to a medical professional or administrator or health policy expert who is not livid about how the testing has worked in this country, or more specifically, haven't worked. The shortages, the lack of labs to process, the limited kits we even have comparative to the world, etc. That said, you must get asked, I can't guess how many times a day, when can I get a test? There's been a lot of misinformation from Washington when those tests would be available. Do you finally have clarity on how to answer that question when patients say, doctor, I want to get tested?
Well, yes, and you're absolutely right. You know, considering South Korea did something like 20,000 tests and China has done maybe 100,000 tests, and we've done about 10,000 tests in this country. So, yes, the laboratories are gearing up. The State Department of Health has a laboratory that will test your patient for coronavirus, and then it is confirmed by the Communicable Disease Center, the CDC. Now, obviously, the best thing would be to have an individual hospital able to do the test. We can do that for flu, influenza B, and influenza A, but right now, we can't do that for the coronavirus. Now, you've got to understand how these tests are developed. Clearly, there are commercial labs now who are offering the test. The problem is the results come back within 5 to 6 days, and I am told that they're swamped. So, yeah, it's a bit of a problem. And the clinician, such as myself, has to look at a patient and say, you know, I think you have corona or you're COVID-19 positive in my mind, or maybe you're not. And maybe we could just send you home and quarantine you, and we'll get some samples and we'll keep them until we're able to test you.
Well, we heard at least from the Hill today that they're streamlining all the processes. The kits are on their way. The cavalry's coming. We all know, we've heard that many times before, and it hasn't delivered. But, you know, it's just so infuriating. We're sitting here in the middle of March, and we're crossing our fingers that next week, finally, we'll be able to know the scope of the problem we're dealing with, and then, obviously, treating it all. But, Doctor, I appreciate a few minutes with you. Thank you so much.
Thank you, Mr. French.
We'll be back to close out the week.